On tonight's Two on Your Side Town Hall, the U.S. hits another vaccination milestone as New York State opens up universal eligibility. A local hospital epidemiologist helps us understand the many pandemic headlines out there today.
Plus, as the country debates the big $2 trillion infrastructure plan, our Verify team digs into one of the main criticisms of it.
And as the Pagulas study the current football stadium in Orchard Park, there is still plenty of talk of a new home for the Bills. What architects consider when designing new stadiums.
We'll get to all of that. First up, our goal here at 5:30 is to get answers to your questions. And the vast majority of them for a long time have obviously been about the pandemic.
And the truth is, it's not always easy to get a response from the federal government, like the CDC or even the state health department or the governor's office. But we were almost always able to take questions or concerns to the lieutenant governor, Kathy Hochul, who is also, as you know, a Western New Yorker.
Yeah, that helped. Importantly, she was also put in charge of managing the pandemic from the state perspective for this region. But we haven't heard from Hochul in quite a long time.
It has now been 10 weeks since this vaccination event at St. John Baptist Church in Buffalo. This was late January, the last time Hochul answered any questions from the press. Today, she attended a virtual event for LGBTQI Advocacy Day. She's done a lot of virtual appearances lately, but her office has refused to welcome reporters to any events or answer questions at all since sexual harassment allegations surfaced against the governor.
And look, she's not to blame for what the governor did or did not do, but she is an elected official and she's in charge of handling the response to the pandemic here, and she's been silent. Today, her press secretary responded to me when I asked to talk to her, saying, quote, "We'll let you know when she's available." That's the same response we got a month ago.
And there are a lot of things that we could be asking Hochul, many of which are about the pandemic in terms of the vaccine, reopening schools, restrictions, and the increase in new cases, and that's just for starters. And we should note she has appeared on this show several times before and is welcome here anytime.
Yeah, we hope that she will end her media blackout, 10 weeks and counting, because New Yorkers elected her and Western New Yorkers deserve to hear from her.
And we should point out, we don't know if Hochul just won't answer questions or if she's been given that order by her boss, the governor.
Yeah, just one of many things that we'd like to ask if we could.
For now, though, we will press on with the latest on the pandemic. Just a short time ago, President Biden announced that the vaccination effort has picked up enough that their goal of having every adult eligible by May 1st can now be moved up to April 19th.
Yeah, moved up almost a couple of weeks. Of course, here in New York, we hit universal eligibility earlier today. Anybody 16 and older can now try to get an appointment. Meantime, some encouraging news today from Moderna in terms of how long its vaccine provides protection. Several big topics we'd like to discuss related to trying to end the pandemic. So let's bring in Dr. John Sellick, hospital epidemiologist with Kaleida Health and an infectious disease expert. He joins us now live. Great to see you again, doctor. Thanks for your time.
Good. Great. Thanks for having me again. I always enjoy being here.
Always great to have you here. And we do want to start with some of what President Biden said late this afternoon as he addressed the country from the White House. Let's listen.
New variants of the virus are spreading and they're moving quickly. Cases are going back up. Hospitalizations are no longer declining. While deaths are still down, way down from January, they're going up in some places. So you might ask, everybody's asking, what does that mean? I understand that people may find it confusing, that the vaccination program is saving tens of thousands of lives, but the pandemic remains dangerous. Let me explain it in a single word: time.
So the president pointed out the majority of Americans remain unvaccinated. And when you look at Western New York right now, how are things looking when it comes to this race between the vaccine and the variants?
So this is, I think it's remarkable when you think that a few months ago we didn't have a vaccine, and now we are, we're at the point of having, I think we're up to like 127 million doses of vaccine given now across the country. I think Western New York, we're doing relatively okay. We've seen some other states, West Virginia in particular, everybody always talks about, their their geography is a little bit different, and I think they've been able to roll things out a little bit better. I think it's great that we have this kind of availability, and I would just encourage people to not be discouraged. I know there are a lot of people who spend a lot of time on the computer every morning trying to get themselves a vaccine somewhere, and I would encourage you to encourage everyone to continue to be perseverant because they will be available. We have reasonable vaccine supply now, and hopefully we get that rate up. As we've talked before, we don't know exactly what the magic number is, but it's certainly more than the 24, 27% of the population that we've seen vaccinated so far.
Really does segue great into my next question, Dr. Sellick. I want to share with you and with our viewers an article that got posted late today from the LA Times. This is a major story that's developing out west. The governor of California announcing that state, California, our largest, aims to fully reopen its economy by June 15th, so a little more than 2 months from now. When you look at the vaccine numbers and you talk about how we have to get to a pretty high percentage, do you think New York could be fully reopened by mid-June like California, or maybe even sooner?
Well, I'm always a little bit hesitant when people say we're going full bore, fully open, 100% open. I think that we've known from the beginning that this was going to be an incremental process. So rather than just picking a day, as some governors have done so far, and say, okay, at this particular day, everything is open, everybody's masks are gone, let's go for it. I think we should be a little bit more meted in our response. And obviously, we're going to have a big benefit now with the weather getting better. We're going to be outside more. So, hopefully that will work to cut down some of the transmission as well. So all of these things aligning the right way will get us to a better place. But I'm always hesitant to say that, we've got a particular day and on this day, everything's going to be better.
One of the other headlines today coming from Moderna, with researchers looking at dozens of people 6 months after they got both doses. They all had high antibody levels. So it's good news because it shows the vaccine lasts at least that long, probably longer. But what stands out to you about the lasting power that we've seen so far with the vaccine? And what about the idea of possibly needing a booster shot at some point?
It's really remarkable. I've given up trying to throw any cold water on anything with these vaccines because, every time we raise a concern, we get data that shows the opposite. So we now have both of the mRNA vaccines, the BioNTech, Pfizer, and Moderna, showing that you have good antibody levels at 6 months. Antibodies are not the only part of immunity. It's the part that we can measure very easily. You just get a sample of blood, and we've been doing that for 100 years. The other parts of the immune system, the T cells and the what goes on in the tissue, is more important. And it certainly seems like we're going to get some good mileage out of these. I think on the realistic side, I really don't think that most of us think that this will wind up like measles, where you get this, once or twice, once with a booster when you're a kid, and then it's going to last you, decades or your whole life. I think there's probably going to be some need for, repeat immunization at some point. Both Pfizer and Moderna have studies going on right now looking at the addition of doses, changing their formulation to take into account some of the variants that we're seeing. Fortunately, this is probably, coronaviruses don't mutate quite as rapidly as influenza viruses. So I think what we're hoping is that, if we get a good solid year or two out of these, and then, maybe we need periodic boosters, I think that would be a pretty good trade-off.
Yeah, absolutely. And Dr. Sellick, we're almost out of time, but I want to ask you about this briefly. We were talking about it, about children. Trials continue, obviously, looking at how effective and safe these vaccines are for kids under 16. But there's this poll that came out from Axios and Ipsos asking parents if they are likely to get their children vaccinated once they're eligible. 52% said yes. In 10, 15 seconds, does that encourage you or does that worry you?
Well, I think if you look at it in context, this is similar to what we saw with vaccines for adults several months ago, and we've made good progress with that. And if you look at all of these studies, they all look at a little bit different populations. The Kaiser Family Foundation does a lot of these. CDC has a contract with the National Opinion Research Center at University of Chicago. And you look at many of these, so they'll say maybe half say yes for sure, and another 15 or 20% say, yeah, probably, and then you're down to that 30% who say no go. So I'm hoping that we can continue by education and by people seeing how well these vaccines work, how safe they are, how few side effects there are, that we'll be able to get a lot of people on board.
We've been going in depth with the headlines with Dr. John Sellick with Kaleida. Doctor, thank you again.
Thanks again, guys. Be safe.
You do the same.